Hello and welcome to the RxEZ channel. Today we will be exploring the topic of opioid medications and the epidemic. So, the United States is currently experiencing an opioid crisis as more opioid drugs, are being misused and abused. So, this has become a national emergency that needs to be addressed. And there have been efforts in trying to find the right treatment and preventative measures. So before we get into the scope of the opioid epidemic, let's look at the opioids closer. So what are opioids? Well, they are medications that work in the central nervous system. Specifically, they are receptor agonists working on the mu, kappa, and delta receptors. Now, the medical community knows these medications as narcotics or controlled substances, and their purpose is to alleviate pain. They can cause euphoria and respiratory depression. So, they're commonly used to alleviate pain from a certain condition or maybe a surgical procedure. Currently, in the drug market, there is a variety of different opioids available in brand and generic form. As you can see, the list is very extensive, and an opioid is chosen based off its potency, which varies from drug to drug. Opioid medications come in many different formulations, including enteral and parenteral route. So most commonly used are capsules and tablets, but for those that have difficulty swallowing, other routes are also available, including nasal spray, injection, sublingual films, and of course patches for more convenience. If you are prescribed an opioid medication, make sure you are certain to read the auxiliary labels your pharmacist have provided, as these are warnings that you should know. Most importantly, do not share your medication. This is a controlled substance that is prescribed specifically for you and your condition. Keep it away from children and animals. Also, do not take your medication along with drinking alcohol, as that could be a bad combination. Try to stay away from operating heavy machinery, as these medications may cause drowsiness and dizziness. And if you are experiencing difficulty swallowing this medication, or may have felt some sort of upset stomach while taking the medication, it is best that you take the medication along with food or milk, as that will help. And then lastly, if you're prescribed an extended release formulation of the medication, you should only swallow those tablets, as if you were to crush, chew, or dissolve them, you will not receive the proper effect this medication was intended to give. The opioid epidemic is referring to the misuse and abuse of prescription painkillers. As a result, the patient gets hospitalized, and depending on the severity of the overdose, it may even lead to death. On average, 115 American lives are lost due to opioid abuse. It really is a tragic consequence. Just imagine how a mother would feel if she lost 2 of her sons in one night. This did in fact occur. On June 14, 2015, Nick and Jack were celebrating a high school graduation party. And during that party, non-prescription hydrocodone was passed around, and it was combined with alcohol, which turned out to be lethal because, as a result, both these boys lost their lives. When you look at the opioid epidemic by the numbers, it really is devastating. Just in 2017, there were over 70,000 deaths due to drug overdose in the United States. And if you look at the map, as you can see, it really has become a nationwide crisis. Ultimately, we know that opioid overdose can lead to injury and death. Now, as individuals, we want to help those that are misusing or abusing opioids. So the first step is to be able to recognize the symptoms, best represented by this opioid overdose triad of symptoms triangle. So recognizing if they have pinpoint pupils, if the person has slowed breathing, they have signs of respiratory depression, and then of course if they're completely unresponsive, they're unconscious, so you would need to get help right away. So how do we solve the opioid overdose epidemic? Well, first we approach each person individually, consider their patient profile, and assess their level of addiction. Once we have an idea, we could then get them the right help that they need by directing them to the right program. There are so many government-funded programs out there that specifically aimed for substance abuse. And these programs include inpatient or outpatient rehab, or medication-assisted therapy is available as well. So they help the patients get through the withdrawal process and help them detox. So who's at a high risk for opioid overdose? Well, it can be anybody. Maybe it's someone who lives with someone who gets prescription opioids and they store them in their medicine cabinet. Well, the other person could easily go into that cabinet and start abusing. Maybe it's somebody who actually needs the prescription opioids because they have chronic pain, and over time they're going to build tolerance and they're going to want a higher dose, and then that could lead to overdosing. Or maybe it's someone who, has a chronic condition like HIV, lung, or liver cancer who deals with unbearable pain. As I mentioned before, there are ways an individual could get help with their addiction. First is to make sure that they have naloxone on them, for any emergencies. There are, of course, counseling and behavioral therapies out there that provide even, medications that could help with the weaning off these drugs. And then there are some facilities where a person could check themselves in if it gets so, bad that they can't do it on their own. They need somebody to help them through the process. All right, so we've come across somebody who has overdosed on opioids. What are we going to do? Well, the first thing is to always call a first responder. So as the paramedics are coming, we can take action. If we have a reversal agent on hand, so that could be naloxone or naltrexone, we could go ahead and administer it before they come. Now, maybe, the patient who has overdose may actually have it in their pocket. So we have to look for it and administer it. Now, there are two reversal agents available in the market. That's naloxone and naltrexone. So naloxone is an opioid antagonist that's available as an injection and nasal spray. And just recently, or the most recent one that was approved was that RxEZ, which is actually an auto-injector that offers voice command or instructions on how to administer it correctly. And then naltrexone also works as an opioid blocker that is also able to treat alcoholism. So Revia is one formulation, and then there's an IV form, Vivitrol, which works on both alcohol and opioid dependence. Thank you for watching this episode. Please don't forget to subscribe to our channel and leave a comment.